Assalamu alaikum wa rahmatullah. Greetings to everyone. Ngamol be sama ngamol be konton. Being a press conference la soto mi alonko lafta kake mimbe dending nying musol la wula kono tala bari jenim be duna kono folon si na moli tandi mol mi alonko wolle be nying ko koma follow na president babi janne minketa Mr. Ibrahima Faderati sign light in girls education atele mo wala president wati wokola mimbe siringa dala wolom umi jameti atele mo na trésor abati mi alonko na nafulo adunya na fintinya atele be mararinga la wokola mbulu bakarola jang ngamin soto jang wolom Mr. Alasana Jiteti mi alonko atemu lecturalty Gambia University bari ate fanambe nyinka fole kono ate mo na resource passing nete nim nga programme soto dawoda na tele kata pour kamol fahamundi kamol londi mimba bala umu amedi sowleti ate be do wala nasle national aid secretariat abe woleto birkama jang ila office o bimbi jang atele mo ila nasla coordinator di mimba bala wolom madam Fatou Bojam mo ndoku nyoleti mi alon ko nabe be nyinka fole kono sanji jama adu molo mi alon ko afana wani yata bake grassroots wala nyin duma do ko la ni nata community kono mimba bala wala lamin jammeti ate mo funding keleti mi alon ka bota birkama jida funding kel la kafo ani be do ko la le ani west coast funding kel fana be do ko la fana mo moti mi alon ko alhamdulillah wani yata nyin ko kono mim fanam badala wolom Dawda Bayo be shine light in girls education leti ate fanam volunteerity mi alon ko fambole doron kana ka kafumolla mbenga do poke and at the same time amu karamunto teacherity fana karandir lalo mati. So without wasting any more time, I have Alasana Jite on my right hand side here. Alasana will take us through. Alasana, you are highly welcome. The topic of the discussion today or the conference is FGM and law, because we all knew that 2015 Women's Act, we all knew that this bill has been passed to the National Assembly, and now that there is a law banning the FGM. So when we said the law banning the FGM, meaning we have to be very, very vigilant and be very mindful so that we cannot do something that will give us a problem, or our parents or our brothers and sisters. So without wasting any more time, Alasana, the floor is yours.
Assalamu alaikum, Gambia, assalamu alaikum, the entire world. Thank you, Auntie Farmer, for that wonderful introduction. I'm really happy and impressed to be part of this press conference. It is very important, and it is about issues that are affecting human beings and which is very critical. We all know human beings are the most important resources and are the most important living things on earth. So therefore, anything concerning them should be a concern for everyone. More especially, we're talking about a category that are very critical in our society, that is about women and girls. In relation to FGM, we know that already the Gambia, it is against our law to practice FGM, and the National Assembly have enforced this law that now the law will stay, that nobody should practice FGM. So I will encourage everybody, every Gambian, for us to adhere to this law. And even though sometimes some people may have some personal issues or different perception about it, but as far as it is a law, and it is incumbent on every citizen to ensure that we adhere to this law. And this message should be very clear, and people should take it very positive, because let's look at it. Even those who related to Islam, we believe that they said that is a sunnah. Yes, it is a sunnah. If it is a sunnah, fine, it is a sunnah. But this sunnah, if you do it, fine. If you don't do it, fine. But now there is law that is telling you should not do it. When you do it, is against the laws of the country. And also sometimes we do hear people talking about it, different scholars having different disagreements about it. But the point is, in Islam, it is important also to preach peace. Most of the videos that I have watched, sometimes the statements coming from other side of the group, these are some religious leaders, the language they use is like a way of instilling violence in people. And Gambia is a peaceful state, and Islam itself is peace. The way we pass our information and the way we express our ideas should really preach peace, because Islam itself is peace. So therefore, I will encourage everyone, every Gambian, to adhere to this law, to stay away from the practice of FGM, as long as there is a law in the country that stop FGM. And I would also encourage government to ensure that they, of course, continue to do monitoring to ensure that these laws are enforced. It's not just about having the law as white elephant, but these laws should be implemented if anybody choose to go against it. So I thank everyone for having me, and I hope Gambians will take this information positively and process it to protect, to use it to protect our women and girls. Thank you very much.
Thank you. Thank you, Mr. Alassana GT, for that wonderful speech. Mr. Saul, the floor is yours.
Okay, thank you very much. Assalamu alaikum to everyone here. And I'm sure this is LSTV, right? And you must have a lot of followers online. My greetings to all of you. As highlighted earlier on, my name is Hamadi So. I'm a health worker and currently serving as the regional coordinator for HIV services in the West Coast region under the National AIDS Secretariat. I've been working as a health worker from 2006 September. Remember, 1st of September 2006 to date. I have been served in different capacities in different regions. I've supported in the implementation of healthcare services from primary healthcare to secondary healthcare, and currently coordinating services at regional level. The topic of discussion today is FGM, and I must thank the Sign for Girls Education for giving me the opportunity to join this crusade to add on my voice on FGMC, but on medical grounds. For sure, in the past few months, we've seen or heard FGMC being discussed at different parameters, from the religious parameter, from the socio-cultural parameter, but I am talking from the medical parameter. And I think they said if you're not healthy, no matter how much money that you have, you're still not wealthy. It's just like health is wealth. If you look at the manner in which FGMC is practiced, we have concluded through a research. I will cite from the Demographic Health Survey of 2019-2020, which suggests that over 95% of those that are, that have gone through FGMC, had gone through it under the age of 5, and most of them went through it the cultural way. And if you look at the definition of FGM, medically, it involves the partial or the total cutting or injury to the female genitalia. And the female genitalia has about 3-4 different parts that constitutes what we call the external genitalia. You have the clitoris, the labia minora, the labia majora, and the vulva. And the urethra. So if you put the vaginal orifice and of course, so if you put all this into context, it will give you the external genitalia, of a woman. So FGMC involves cutting or injuring this part, this very important part. All these organs that I've just mentioned here are very important when it comes to sexual and reproductive health of a woman. And tampering with them, of course, will have adverse effects. I am not talking religion, neither sociocultural. I'm talking from a medical perspective. And like I said, once a woman has these parts, these very important parts of her body tampered with, for sure you're going to expect that either there are immediate complications, short-term complications, or long-term complications. And sometimes when I hear people say, oh, I mean, we've seen women who have delivered and 300 children, nothing happened to them. Well, in medicine, that's what we call confidentiality. We cannot go to the market and hold a microphone and start telling people that, so number of people or so person has this so problem. And if you look at sex and sexuality in our sociocultural context, this is a difficult platform, a difficult area to talk about openly. Sometimes even mother to child, it's difficult to discuss things around sexual reproductive health. So there are women on the streets who are walking, dressed very beautiful on the streets, but they're faced with problems. They're suffering in their marriages. They're suffering in their relationships. They go through what we call intimate partner violence. But these are things that maybe the reasons that will be advanced would be on the surface. Nobody will tell you, oh, I couldn't. I refused to have sex with my husband because I'm dried up, I have bruises. Even your own biological mother, sometimes, you find it difficult to express yourself in that context. So the problems are there. From the first day that the circumcision or the cutting is done, up to the time, after 10 days, up to the time that the child reaches the age of puberty, like experiencing her first menstruation, that is at age 11, 12, and through the productive age, there are complications at labor, when the woman is giving birth. There are a series of complications that we've seen. I think it's high about time. Hence, there is a law, that has been passed it has been passed since 2015. And there has been some queries about its legitimacy, and it went into Parliament, and now it's upheld, it's strengthened. So, like the previous speaker said, the onus lies on the government now, and not only government, but everyone, to ensure that whatever whoever practices it, the law takes its course on you. We're doing all this not because of money. We're doing it to protect our children. If you work as a health worker, especially in the labor ward, as a midwife, you appreciate the suffering that women go through, during childbirth, because, like I said earlier on, the complications at the time of conducting this FGMC, it's like sanitary conditions is like infection control becomes a cause of concern, because if you're using one knife or one razor blade on different children, obviously you're passing infection from one child to the other. And the environment in which you do it, the cleanliness of the person who even does it, the hand, the hand is a place that carries a lot of infection. So, this is why you go to the hospital, you see people putting, the health worker, whatever he does, he makes sure that he puts on gloves so that there's no transmission of pathogens from him to the client, or from the client to the nurse. So these are things that we see lacking on, at the time of conducting deliveries. FGM. And if you look at it, you realize that FGMC is done at bathrooms, behind bathrooms, places, in isolated places. Infection control, it's absolutely not observed, and this is why medicine has frowned on it. And WHO, UNICEF, UNFPA, these are bodies, the international bodies who have the welfare of women and girls at heart, and they said, whatever you do with FGMC, it is not to the best interest of the woman or the girl child. So this is why they frown on it, and I'm happy that the laws are passed. I hope that we will uphold it to ensure that women are protected when they give birth. When they're young, because like under 5 years, this person is innocent. There are people who are going through complications today. I'm very optimistic that if you had asked their opinion, their consent, they would have rejected, the infibulation. We've seen it happening. Where a woman is cut, you cut the clitoris, and you prevent the woman from having that natural cleansing ability. as well as been excited. I mean, been wet during sexual contact, and now you go and seal the woman, leave a small hole that would just give space for urine and menstrual blood. You know, at the time of birth, you have to go and defibrillate the woman. You have to go tear her up for the husband to have access. And I was made to understand that traditional way of doing it is like once the woman is open up, you go back to the man the same night. You know, see the pain, look at the pain there. There are no localization, there's no lignocaine or something, you know, no anesthesia provided. So the pains are debilitating, and we can carry on talking about the complications till tomorrow. We wouldn't end it, but hence is a press conference, it's not a sensitization. I would summarize it here, but the truth of the matter is that someone asked me, oh, okay, if you medical personnel feel that FGMC is not done the right way, why not we medicalize it? The answer is no, because it has no medical benefits, not at all. So there is no room to give it a chance to say, okay, let the health workers do it, and they do it differently. So on that note, I thank everyone for listening and watching. I hope that we would stand as a people to understand that, you know, like I give you a typical example. When someone has diabetes, you know, the medical doctor will say, oh, do not drink anything sugary. Make sure that you check your blood sugars level. They give advices and you go by that. So if they're now telling you that FGMC has medical complications, why shouldn't you give us that respect and give us the credit for bringing out real-time evidences? So on that note, I stop here and give the floor to the next person on the line. Thank you very much.
Thank you so much.
Thank you so much, Farmer. I'm very sorry, my voice is gone since yesterday. Okay, sorry. Assalamu alaikum. Mejama Misri Mulbe Kontona, Mejama Mulbe Kontona, Mbe Jubir Lalbe Kontona. Bin singo me minti jam wolomu. Kadiyamu moli, especially Musoli. Dol kay na wula kono ta, dol kay na nyakato ta, dol fana fongo ba fulay ko sunnu nata kadiya musoli nga ñoo kono to dia nga lon ko ñimu fennati mi yalan kati ko anin na dino ma ñoma ñimu na adolati ado dum kulati mi yala ko taraku ko tolem nga taram mu molla ibake kan manñini kar ken dun taje mbake kan so nin nata jew ado nyin abe mantora kan ndol kilungol lata murun nan ko few min be mantora kan alingo wo bondi adiya mo siata a choko warta bari musolu ndol musukundato nene te damin ndol le ngalong nin kamin ken na ngalon ni nin tol be futu bundato ni nata ke wala side ntol be ala na society kono munen ne ka fuko nasruwa muso ni emira munan ne ka wofo imam mandika muso no parela imam jola muso no tabirola bar munan na ke wol dakatu nasruwa muso ka mbe ngalon ne na bo nyama ko min ben tol man toralan tol musolu nko nga bulale andum luwale be laringa to ntebe challenges le dila with the authorities, the lawmakers, most especially the judiciary. Alina luwa buko read kuke about FGM. Is it 15,000 or 50,000? Is it 15,000 or 50,000? Alina luwa buko read kuke. Isa jemi yake luwa ya ma. Bari jammi luwa bete fana mal. Ite ya lon ko ite muso ya lon ko ite ni ala tema. Nga muso doli jeja wol nim pampas lebe tamaka. Nga muso doli jeja jamato ni sita ka sinanni. Mafu abemu FGM lati but a jamamu FGM lati. Ni ba foka nga simbalu. Nga simbalu fo mu jumal lati. Jumal le nga simbalu ti. Uluka ke molati min ya lan gatiko. Imum ma molati o imumba malati wolle kan simba yake nimbe diyamula na usasol ko iko hanim mabula ika do mandingo bondiji ninna to do mandingo la ni yeko podi tele ko nyata jirim bina yeko podi alasane le kay ta jirim bina yeko podi fama le kay ta jirim bina ntele jioni alasane le jirimo woni fama le jirimo ta kanyana probably for alasane wobi ko fa le felena ako wala le jirimo ti so wodo mandingo ka min kuntu abe maison wala nyaadil de so maison men ntolu ngam min fodo abe mantora kan e diyembe musol mantora kan na wuludulato na futu bundato I konkana dia amala ngo mbatata le mbediya mulale kata be mbatandi kanne mbediya mulale kata be mbatandi kan na wulu bundal tole kudu imagine futu kewaye suto si ka prasta mon nyinin kay dingo bulu ika prasta mon nyinin ka puru ke wo salon ko bi itita no la birkama pra salon ko biyo birkama silote manola ngo fo lon futu nyati ba nganyina duwa momo fututa na usa sol franka fo muso manyanne ko dile la muso ikela futu bu ngokon doto handa tarebe sasarin iyo wala fo ikon kana fa hani iyo bare sai ni problème o be te kunto ndunte lola mo be nyaato nak kan na fano yele mo be o te keno la nte ba tandi la docteur do renela probably fon ta tandi la docteur o fon la fa nte ni wodi mo be to lale fo dayman abada nganda silinto mum no toroti ika no toroke nyaadile ni no toroke iko ni be dunna kewoka wolu le nyanta kan no toro bondi wolu le ta nyanta dunna kewoka pour yo futuoke ni yamira muso dolu wala na buso buka bamman no futo to ko take kati ko ibe bara maro la kala je yela ne kanin kewo yela wodi minna beka tare ko konole asatin na ko futo se kuye ndi futo nyanta ka kediya do ronati futo manyan ko ya so to la nyanta diala le ibe futo la wato wati.
As alluded by others also, I think we the women, we have to make sure we protect our girls. And those men out there who are campaigning bitterly for this bill to stay, I think it's time for all of us collectively to make sure when we go back, we go to our grassroots communities, we continue with our advocacy and our sensitization. We cannot just relax and stay. There is a bill that says no to FGM, so therefore we have to relax. Now is the time that we have to fasten our belt to make sure we continue with the advocacy. On that note, I thank you all for coming, and without wasting much time, I just have a few questions to ask in Mandinka. Mbalbe tentula bake mbal jayila alla na ko nyimala le presentation o min fananke na diamo bita mbadi musol le kambake komin musol min be banta siata min ya lonko iti angale kan wala moy la no antega nyinin kar dan tan soto drombe min kela Allah. I just have a few questions to ask Alasana. I just want to ask you, what advice do you have for the government as far as this FGM is concerned?
Thank you very much, Auntie Farmer, and thank you, Mr. Sow, Madam Boja, and everyone present here. The advice or the reminder I will send to the government is that if you are a leader or you are responsible for your state, you have to make sure you stay with your word. Reliability, consistency is quite very important. As far as the parliament have taken a decision and then we have agreed as a country, as a nation, and that we should be guided by laws, principles, and that will, of course, enhance our moral values. So the advice I will send to the government is that let them continue to monitor and to ensure that anybody who violated this law, of course, face the consequences. And that's the only advice I have for them. If you really want to be respected by your citizens, whatever you have as a law, you should make sure that they adhere to it, and then you implement any body who go against that law. Thank you very much.
Thank you so much, Mr. Giti. Now I have another question for Mr. So. Mr. So, as a health worker, and you were working with the Ministry of Health and still working with the Ministry of Health, I think, and as the coordinator of National AIDS Secretariat, currently in West Coast region. As a health worker, what are the measures in place, or how can we measure the FGM cases in the hospitals?
Thank you very much for that question. I think for the health fraternity, the government has, through the National Assembly members of National Assembly, helped us in ensuring that there is some control mechanism, and the control mechanism is putting up a bill or a law, prohibiting the practice of FGM. For the medical field, I think one very key performance indicator, or one key intervention area that any Ministry of Health or any government should invest in is research, because research would help to inform real-time empirical information regarding the existence of a problem. So I call upon myself, of course, and to everyone, especially the RAMCA unit, that is a reproductive, maternal, and child health with adolescent health unit of the Ministry of Health, to step up, to find ways and means of conducting research at all labor wards, even if it's going to be at a pocket, at pocketed areas, let's say a concentrated area, whether GBA or probably in the provinces or in maybe some few hospitals. But it's very important that research is conducted to bring out real-time information, real-time data, to showcase all these complications that we are talking about here. I know if you do literature reviews from international journals, from well-respectable journals, you would see that there are some respectable research scientists, social scientists that have ventured into research, and they brought out real-time evidence suggesting all these complications that we're talking about here. But to make it more robust, I think it would be nicer if we have our Fabrama or our Dr. Sisi or our Dr. Njai or someone coming on national TV to say at Jama Foundation or maybe in Brikama District Hospital or in Basse, in our labor ward from January to June, we have registered this number of maternal sepsis, or we have registered this number of maybe bad asphyxia, or we've registered this number of maternal deaths as a result of complications arising from FGM. I think it will be more appreciated. So it will be difficult now, because I remember in 2020, just before the corona, the RAMCA unit of the Ministry of Health started an initiative like that. They wanted to do kind of like an observation study to bring out information on the cases that comes to our maternal, like all the abnormal cases that we register in our maternity units. What are some of the reasons, possible reasons as to why they come up with those issues? But when COVID came, there was diversion of funds. I was made to understand. So every focus was on COVID, but that's not the case. That's not an excuse So we hope you will have the opportunity to do the research now. To students who are in the academic field, the university students, private individuals, government institutions, private bodies should find ways and means to beef up research so that we come up with data, from this like aforementioned places to support our argument. But of course, with or without research in the Gambia, like I said, international journals, respectable and recognized journals, have come up with real-time data or real-time information to correlate other medical conditions to the practice of FGM. Thank you.
Thank you, Mr. So, for that reminder. And I think this video or this conference will go viral, and the Ministry of Health, they will have access to the information. I now call on Madam Fat Bojang. Fat Bojang, itibi siring Gambia musul bile to yala jambi bawo ntenite be musul eti so kabili nying luwa nying afuntita mobe aje ko luwa nying abantale continue tele ka bana mantara ka ke kotenke so itibi mu yamar le dila mbadi musul la minul yalon ko surtout minu ka funti national platform wolto e ka itandi ko ntolu bakelale hani bibi ni moya di musambana ya nte bakelale so ite mun ya mar soto nyanta min dila o musu sifal ani musolu be in general pour nyin kamma nsenna dimbayal tankandino nse o musolu fanan tankandino luwa kana laykan
yo abaraka baake fama comme mbe min fo kandoro musol molati mi yalan katiko ni musukilim ma e nyanta musobe malale e ko luwale be nyinte manto ni nyinke luwabe malale woto kana ke luwa ka ne ma kabri ni luwa dunde kabin 2015 nin hakilo bakan ye ni luwa dundi ay musolu mimma mini dun tato iko mole sotota mi yalan katiko ayela kodo joyele bida e kodo joye wo kodo jamma be wo jole na yeso wala abe dunna kudole to jamma ba jole na yeso wala nun tenu abe dunna kudole to nsekke molti mi yalan katiko mini kata national assembly ka musol mobilize ala fo e mba kelale musol ye da bondi ku sifa kono kantum mi exemple o tal mina fitino na be laring abula e sinu ala man tankala ko na keta ja musol ni kebe borral kewobe borlale bar muso te borla ya di mutuje bayri muso te borla di mutuje har man tankala ko musol kana wodua alinga nyirwa mutanga bunya musul katu nyirwa be mbatandilale abe mantora lale alinga luwa nyimbunya nga horma mo kana toldundi ko kono ko mi yana katu sini sama betan torale fama ngamira ngawni na joko kono ka joko musol ye luwa bunya ngam fa horma ngam fa bunya yo abaraka bake fama asenata.
Thank you, Madam Boja. Abaraka bake yamaru mindi ngamra mbele wo yamaru moinyo nyala. This goes to the general public. It's not just for the women only, but to the general public. And we have here Mr. Lamin Jame, who is also a youth and a youth leader for that matter. And Lamin Jame, I have just few questions for you. Since the ban of this FGM law in the Gambia, you are living in a society, you are interacting with women, youths, and some religious leaders also. What are their reactions in the community, or what do you think they're speaking about? what is the mindset speaking?
Okay. So, assalamu alaikum. Mbali be kondon atol na jamunona minu bejang. So from Nas, Fatu Bojang, Alasana, and Sign Lights for Guards. Mbali be kondon na LSTV. Mbe badin Gambian kontona mbe Gambia mfana be sirim banda mbe kontona mbe tentambe jaila. Nin press conference wa kumata bake because muna kumandi fenne be kaja kam miyalon ko alafta diamo wulanda maltema kaji ko kachala kanyu faham ila nyinin kara kumata le gol mindi ko bawo ngajele kachala ke jana religious leadership na dina nyaron kulu ka fulu musulu na local authority pour kanyo kono dia minna wala mindi ko wala kono tambe kering alquran wala ni nyaadi le na adu ya na ni nyaadi le na chosano ya na ni nyaadi le mi importa wala mindi ko kachala ketale adu nyomo ketale yo bari ni dara bankol fana luwal le beji banko na luwalem ibora je tara daw banko na luwalem so wo luwa ni tara je tara daw da e nyanta luwa khormal ya bunya yaajo ko pour ka luwani ka sementu yandi yo ngaji ko kacala kita masa kunda sai wala kono ta ya balle mo be nyanta fa hamla de mo be nyanta lon de in the sense ko kana musol protect niko protection o amake wala kono ta damadi tuwabol ka fola gender based violence niko gender based violence wala kono ta bolto yana sikeloto yana kudolto yo bar comme ça fi bi mimbe foka wala mun wala kono tadi nga karamta ko député min kana loi de da e loi ni ya bande ko wala kono ta banta en banko kande mo be nyanta wolon dade say mimbe nyamdi ko ndol manke loi de da dalti bantol wiya advocates kaje ko masa kundala shofen sak fasa bar ni loi ni man bawo député bu ya banle adu loi le ya ban oton tol fana mbelo kante shi de kaje ko wo loi ni miya ban ma make sure ko loi nga ay enforce being security personnel local authorities pour kaje ko loi ni ka semento yani fe ya lon ko ye wula kono tani yake loi le beje masa kunda se muda ye kitindi kaje ko ikana anyonke ko dangi yo ro kamala mbal tentula mbal jeyla ala baraka baki
Mr. President, we have come to the end of the press conference. I thank you all for coming at the high table, the volunteers and the press. I now declare the press conference closed.